I believe that this extraordinary summit congregates to ponder and to sanction the development of time-bound protocols for the progressive reopening of our economy. And this is important because, ladies and gentlemen, the COVID-19 pandemic is both a health crisis, but it is also a crisis to our economy as well. But I do believe there is also a fourth reason why this summit is convened today, a reason I didn't really mention in my address when I spoke last Saturday. And that is, whenever this summit sits, the conscience of the entire nation is called to order. The party affiliations and political dynamics of the moment are put asunder. When this summit sits, its only business is Kenya. No party affiliations. We are encouraging social distancing, but here we are encouraging no political distancing and no ethnic divisions. The summit becomes the heart and soul of our republic, and that's why the pronouncements of this gathering, whenever we meet, become articles of our faith, our common faith in our country. These are articles which affirm the whole cannot exist without its separate parts, and the separate parts equally cannot exist without the whole. When faced with crises like this COVID-19 pandemic, these articles of faith remind us that the national government cannot exist alone, because it will tire. But equally, neither can county governments exist alone. They will ultimately, equally expire. But if we work together in partnership and in fellowship with each other, guided by a shared vision to make lives better for our people, no pandemic is too big for Kenya, be it natural or, for that matter, economic. And I believe this is what the framers of our 2010 Constitution recorded in their unpublished notes, and they documented the power of our diversity and how the negative view that we are different brought out the fight in us when we were threatened. And they call this feature the 47+1. Then they told us that faced with any challenge, the 47 county governments plus the national governments are unbeatable if they work together, meaning that nothing is impossible if we pull together in the same direction. And in this regard, I invite you as elected governments to partner with my national government in the fight against this pandemic. And if we do so, I do believe we will reverse this tide and leave our print on the right pages of history. There is a lot of pressure for us to reopen the country. We have given ourselves 30 days additional, and we have done this in order to ensure that our citizens remain safe. But I do believe that within that 30 days, each and every one of us must do that which is necessary to ensure that even as we open up in a manner that is safe, that protects our citizens, especially the elderly and those who have other ailments and ills that would be ready victims for this enemy of ours if we were to open up without a proper plan. So we need to secure, during this particular period, an undertaking that every county should be able to deliver at least 300 beds in your isolation facilities. And towards this end, the National Treasury has already released approximately 5 billion Kenya shillings for this purpose, and this is intended to support each and every one of you. This is a challenge that calls our county government to be a heartbeat away from our sick ones, with the national government giving you all the support that we can. But if this moment has brought us, if if the moment has brought us this pandemic so that we can embed health provisioning in the counties as envisioned in our constitution, I also believe that then this pandemic is also an opportunity or a blessing in disguise. We must embrace it and grow it. If we fight the coronavirus from the ground up, from the county up to the national level, we cannot fail. And furthermore, we shall leave behind a healthcare system that will be able to deal with any kind of crisis in the future. In meeting this endeavor,
WHO, the World Health Organization, has come out with guidelines on home-based care because 80% of our cases are asymptomatic. These are people you test for COVID-19, they come out positive, but they are otherwise well. And in view of the surge in case of in numbers, it is imperative that then we develop home-based care guidelines, which we have done even previously for other infectious diseases like HIV/AIDS. And in terms of this, the county governments will play a critical role in identifying the home and the community facilities for isolation. This has been worked on by our case management team to be able to develop models which will work for our people. Further, we have translated the home-based care guidelines. We are in the process of translating it into our dialect Kiswahili so that our people can be able to understand it better. And we are also appealing to the counties to go ahead and translate it into the local dialects so that people can understand it, because this is basically the responsibility of the community. If we do that, we'll have the buy-in of the community and they'll be able to comply with instructions and guidelines on home-based care, and therefore will be able to achieve better success. This is the way to go, Your Excellency, because many of these people will have either a very mild form of disease or totally asymptomatic, and it does not make business sense to keep them in the hospital. If we carry out these activities, Your Excellency, we believe our health care system will not be overrun, and will be able to cope even when we reach the peak.
It's clear that revenue is going to fall drastically, and we have no idea how it's going to perform in the years to come. So quite a number of sectors are gravely affected. If you look at the agricultural sector, it's been hit by low demand because export has shrunk. Mainly our foreign exchange earners like horticulture, tea, coffee, has even been made worse, even some situation in the agricultural sector with their own set of locusts. The manufacturing sector, there's low demand, there's a reduction of import of raw materials and other intermediate goods. The financial sector, there is reduced diaspora remittance. There's capital flight as a result of foreigners withdrawing their capital. There's reduced investment inflows. The revenue performance has actually gone down, and all other domestic taxes has also shrunk. If you look at the state of the service sector, tourism, hotels, and all the sectors that have been contributing to the economy are actually doing badly.
We have gotten support by way of PPEs, by way of hand washing, for example, USAID, Rotary International, Logistics Support Center, the World Health Organization, PPEs, SHI, that is the Clinton Foundation, testing kits, and so on and so forth. Some of this support in kind is something we can supplement the counties so that you do not go buying PPEs when we have gotten people volunteering to give us PPEs, and therefore utilize some of that money towards the 300-bed capacities that we have proposed. Your Excellency, I want to say and state here that the cooperation that we have gotten from the governors here present is exemplary. And Your Excellency, we have worked hand in hand with each and everyone sitting in this room, because there is no county that has not been touched in one way or another. Even the ones that have not experienced any cases have been touched because of the preparations that they have been making. A lot of the handwork is essentially at the county level. We have seen various degrees of success and admittedly failures as well in some areas. We have seen, Your Excellency, truck drivers create challenges that we had not, that were unforeseen before. But I must say that similarly, even when the challenges come, we have worked together. We have not assigned blame. We have worked together to see that we overcome those challenges.
On containment measures rolled out towards breaking the chain of transmission of the coronavirus disease, county governments have put in place restriction guidelines of social distancing, including the social gatherings at markets, hotels, churches, and churches. Implementation mechanism and adoption of guidelines, regulation, and protocol developed by the Ministry of Health. Trained cumulatively 16,214 healthcare workers in various cadres on COVID-19 case. Procured PPEs in addition to supplies from the national government through KEMSA. However, we note that the PPE kits are still not adequate, and there is need to acquire more, particularly as the cases continue to surge. A total of 6.2 billion of county budget counties have been reallocated towards COVID-19 response.